Good morning, Corrinne. Thank you for coming to talk to me today about your role as a supervisor for a trainee advanced practitioner. I wonder if maybe we could start off with you telling me how you became the supervisor of one of our trainee advanced practitioners.
So, like a few things with my different roles, my different hats, shoes of this trust, it kind of gets assigned to me. Just, would you be interested in doing this? Someone will say, you seem like you'd be a good person to do this. And also, the trainee who I'm supervising actually asked me and said, would I support him in advancing his clinical practice, in supporting his role, and could we do this together? So I agreed.
Sounds great. So, Corinne, could you tell me about your experience of supervising the trainee APs, and also has there been any differences between maybe what your expectations were at the beginning to how the role is playing out?
So I think I say this to all my trainees, especially advanced clinical practitioners, is that I am a supervisor who will not chase them very much. They have to do the chasing for me. I have a lot of roles, I'm very busy, as everyone is, but I will leave it to them to schedule meetings with me and organise things. And so I expect them to chase me down for time, which is fine, and scribble it in my diary. That's always good. Actually have to keep it in 3 different places probably, so a paper diary, online calendar, and my phone, because I usually triple book myself, unfortunately. But anyway, so I don't think, I mean, I set out the expectations quite early on with my trainees. They're usually very organised and motivated, the ones that I supervise. So I don't think that differed particularly. I think from a time-giving point of view, I knew that there would be a time commitment, but perhaps there was maybe a bit more time commitment with my trainee currently that I'm supervising, only actually because he was the one who scheduled in a weekly meeting to catch up, to go through clinical cases, to go through things of how things are progressing, are there things that we needed to work on together, or things that he had questions about. So it is quite refreshing actually to have a trainee sort of want more time with you, because sometimes some of my trainees, it's almost like they don't necessarily want to spend that much time with you. They want to get the job done because they're just as busy as well running away. So it's quite nice to sit down and have that time together, to go through cases, to drag out some knowledge that's very, very deep, far back. So that's maybe a different expectation, a different thing that's come out of supervising my particular trainee at the moment.
Thank you. And how has it been different to maybe when you are supervising, say, junior doctors or people in different roles?
So I think where trainee advanced clinical practitioners are a bit older perhaps than the majority of my medical students and even some of my trainees, they've got a bit more life experience. They've got a bit more perhaps maturity, not to say that my other trainees are not mature, but they've just had a bit more from life. They have different motivations, so they've clearly worked, they're interested in wanting to do this and advance themselves in a different way, I think, probably from people who are coming through university or sort of doing that day-to-day studying, whereas this in addition to your current job. So you have to be very organised, you have to be very motivated to do it. And it's just, I think, talking to someone a bit more perhaps on a similar level. So although we're from different backgrounds, we've worked together as a team, we've made decisions together as a team. So almost coaching rather than necessarily training. I think probably maybe that's where the difference is.
Yeah. And how does that work when you're working with someone with a very different professional background, training, knowledge base, all of those things that they're bringing in, but obviously maybe is more unfamiliar to you in terms of their core skills and knowledge?
Absolutely. So for any trainee, you don't know for sure what their training background would be. And you'll feel out, where their knowledge is. But you're right, having my trainee who's from a different background, has had different training, their understanding of a clinical situation will be different from where my understanding is, and trying to bring those two streams of knowledge together. And like I said, that's the part that's probably benefited me, is that I've learned from their background of how they would approach this situation. They've hopefully taken some of my knowledge of how I would approach that situation. And actually, we've probably come together to hopefully give a better experience to the patients that we've seen together.
So Corrinne, could you tell me about the benefits and challenges of this role as a supervisor?
Challenges first very much reflects again about the amount of time. Everyone's very busy. But like I said, my trainee now had said, nope, we're going to schedule in a weekly meeting, put it in the calendar, had sent the invite himself. So it's there, it's every Friday. So we've got this catch-up meeting, and depending on other things, you know, if my trainee has to do something else, or if I have to do, we're a bit flexible, but we do still try to meet up and make sure that we're still having that point of contact, if not every week, every few weeks, to make sure that things are going okay. Benefits, I mean, I hope that my trainee's benefiting, but for me, I think the benefit is actually to have someone who's come from a different background and bringing their knowledge and their approach to a certain clinical situation. Usually that's the thing that we're doing together, and then I bring mine, and we hopefully forge a way forwards together, but also maybe a bit more enhanced than if either of us would do something alone.
Yeah.
And hopefully that benefits our patients together. Going back to basics for me, you know, sort of thinking about why do we do things, and instead of just saying that's just the way I've always done it, it's actually getting me to think a little bit about my clinical practice. Am I following the latest guidelines? Do we know if there's a trust guideline that we should be following? Where do we find that trust guideline? Are we doing things safely? Is there something new out there that actually I've not been aware of? So that's really good to bring my own clinical practice as much up to date as possible and make sure we're keeping patient safety at the heart of what we do as well. And then just trying to remember things of, you know, the very basics of things, which is really good actually, because that's why we're interested, I think, of why things work, why things happen, trying to explain things in a way that's not medical jargon. So medics, doctors probably talk very much in a strange code that people don't necessarily understand. And so talking in a language that is not completely layperson's language, but doesn't include all the shortcuts, the abbreviations, explaining that fully to my trainee, actually has probably helped me, hopefully, to try and explain things a bit better to my patients as well. So take the time, try not to use medical jargon. So I hope that's benefited my patients as well as my training.
And what would you say to any other services or colleagues who may be considering having this type of role in their team, or maybe they've been asked to be a supervisor? What would be your feedback to them?
It's great. It is really great. It is so rewarding to see someone grow. I think of any trainee, but especially someone who's coming from a different background, and someone who hopefully is going to add to your service, add to your team. And there is the time commitment. I think the other thing is about knowing what resources there are out there. I think we've spoken about that, Kerry, about having some kind of almost handbook or crib sheet that there are certain courses which are really good for the trainees to go on, which is a good use of their time as well. So things like blood results interpretation, there's a certain course to go on, ECGs, how to read them, those kind of things, things which we could do, you know, you could do with your trainee, but actually it'd be quite nice for each trainee to have a standardized, I guess, amount of resources that they could go and read up about and then apply that to their clinical practice.
Yeah, I'm sure that would help with the challenges in terms of time that you have available to work with the trainees as well. It's lovely. Thank you very much for that today.
My pleasure.